Sobat Tekon TV. Tahukah kamu bahwa kondisi prostat yang membesar bisa menyebabkan gagal ginjal? Loh Min, bukannya ginjal dan prostat itu fungsinya berbeda ya? Eits, jangan salah. Posisi prostat yang berdekatan dengan kantung kemih membuat kondisi keduanya saling mempengaruhi. Jika kondisi prostat membesar tidak segera ditangani, maka akan berpengaruh ke kantung kemih yang ada di dekatnya. Tapi sebelum lanjut ke penjelasan dokter, yuk tekan tombol subscribe dan nyalakan lonceng notifikasinya agar kamu tidak ketinggalan video-video terbaru dari Tekon TV. Lalu, sebelum kondisi semakin parah dan menjadi gagal ginjal, apa yang akan dialami oleh pasien pembesaran prostat jika tak segera melakukan pengobatan? Simak penjelasan Dokter Ronny Tan berikut ini.
Some patients will then present with blood in the urine due to the enlarged prostate, and this blood in the urine can either be due to a big prostate or it can be due to the fact that he's actually developing stones in the bladder. You can see over here on an x-ray what bladder stones look like, and this is what it looks like inside the bladder when we do a cystoscopy or a scope. Other things the patient can present to us will be the inability to pass urine, like I mentioned. You'll be a painful sensation where you feel your bladder is really, really full, but nothing is coming out. And the abdomen or your tummy at the bottom, you find that it actually swells up and it's even painful to touch. So what happens when the patient is unable to pass urine? When he goes to a doctor in the emergency room or his family physician, they will then put in a catheter, which is like a tube, pass all the way in, past the prostate into the bladder and allow the urine to come out. So of course, any man who is active would not want to have a tube in his body for the rest of his life. So a lot of these patients who end up with catheterization will then seek medical attention, especially coming to the urologist to find out how we can get the catheter off.
Kalau begitu, bisa bahaya dong kalau kondisi prostat membesar dibiarkan begitu saja. Yap, betul sekali. Setelah ini, Dokter Ronny Tan akan menjelaskan mengapa pembesaran prostat bisa menyebabkan gagal ginjal. Tonton terus ya.
The other thing about the treatment of enlarged prostate is important is because you can see over here on the right side is the normal situation where the urine goes down the kidney through the ureter into the bladder and is then emptied out. So some patients with enlarged prostate, if they find that they don't undergo treatment, what happens will be the bladder will start to get thicker. Just like any muscle in our body, the more you work out, you have a bigger muscle. For example, over here, you train your biceps, you have a huge muscles over here. But for the bladder, you do not want the bladder to be muscular. The reason is because, like I mentioned just now, the bladder allows itself to be distended like a balloon so that you can hold your urine until the point where you can find a toilet and you can pass urine. So what happens if you have a thick bladder? When you have a thick bladder, the bladder will not be able to stretch. As a result, the pressure will actually increase inside the bladder. And if the pressure cannot be relieved by passing urine, what happens is the pressure goes upwards towards the kidney. And we have seen patients who present to us with kidney failure because of the bladder failing because of becoming very thick wall. As a result, the urine goes backwards and the pressure actually affects the kidney itself.
Setelah menonton video ini, jangan lupa subscribe channel Tekon TV. Share video ini jika kamu mendapatkan manfaat darinya. Terima kasih.